Hi, everyone. So the topic I chose for the signature assignment was breast cancer. Breast cancer is a disease in which cells in the breast grow out of control. Depending on which cells in the breast become cancerous determines what kind of breast cancer someone has. The three main parts of the breast are the lobules, ducts, and the connective tissue. Most breast cancers begin in the lobules and ducts, which are labeled in the picture provided. The fatty connective tissue, which holds everything together, is the yellow area around the lobules. The most common kind of breast cancer are invasive ductal carcinoma. For this type of cancer, the cancer cell grows outside of the ducts into the other parts of the breast tissue. The other type of breast cancer is invasive lobular carcinoma. In this type of cancer, the cells spread from the lobules to the breast tissue close by. Overall, there are many kinds of breast cancer. However, the rest are far less common. Now I will be talking about the etiology of breast cancer. We know the main risk factors of breast cancer, yet the precise cause of the disease is still unclear. Odd enough, most women that are considered high risk for breast cancer do not get it, while many with no risk factors do. The two main risks of breast cancer are known to be age and family history. MIT's Computer Science and Artificial Intelligence Laboratory had a team of researchers led by one of their students, Adam Yala, who developed MIR AI. It is a deep learning algorithm which estimates a woman's risk of developing breast cancer across multiple points in the future based on the analysis of their mammogram and clinical risk factors. There are many risk factors in developing breast cancer. Some risk factors you can't avoid are age, family history of breast cancer, other cancer, genetics, dense breasts, breast lesions, history of radiation treatment, heritage, and more. Other risk factors that you can avoid are weight, drinking alcohol, hormone replacement therapy, lack of exercise, and reproductive history. This disease is known to be the most common cancer diagnosed in women and the second most common cancer overall. Yes, breast cancer can occur in men and women, but it is far more common in women. In 2018 alone, 2 million new cases were reported. 1 in 8 women in the US are expected to develop breast cancer over the course of their lifetime. It is expected that almost 300,000 invasive cases will be diagnosed this year, along with about 50,000 non-invasive cases. About 44,000 women in the US are expected to die just this year from breast cancer. The death rates for women who have breast cancer are much higher than any other cancer. As of January 2021, there are more than 3.8 million women with a history of breast cancer in the US. This includes ones that are currently still actively receiving treatments and the ones that are in remission. The chart included in this slide is from the American Institute for Cancer Research. It is the countries in order of which had the most cases of breast cancer to the least. The United States ranks at number 22. Like mentioned before, most commonly breast cancer either begins in the cells of either lobules, which are the milk-producing glands, or the ducts, which are the passages that drain milk from the lobules to the nipple. To add on, there is also cancer that can begin in the stromal tissues, which include the fatty and the fibrous connective tissues. Now I will be talking about the physiology of breast cancer. Breast cancer affects the connective tissues. It can spread through the blood and lymph vessels over time. The cancerous cells can invade the nearby healthy tissue and make their way under the lymph nodes. Once cancer cells have gotten into the lymph nodes, they have a pathway into other parts of the body. Some signs and symptoms of breast cancer include new lumps in the breast or underarm, thickening and swelling in parts of the breasts, irritation or dimpling of the breast skin, redness or flaky skin in the nipple area, pain and pulling of the nipple, nipple discharge, and changes in size or shape of the breast. Some long-term consequences of breast cancer include spreading or metastasizing to other organs or parts of the body, which makes treatment more difficult and survival chances much lower. The NCI reports that 90% of women with all stages of breast cancer survive 5 years after diagnosis. The 5-year survival rate for women diagnosed with localized breast cancer is about 99%. Overall, the rates for survival include 99% for localized, 86% for regional, and 28% for distant. Tests and procedures are used to diagnose breast cancer. Some of these tests include breast exams, mammograms, breast ultrasounds, biopsies, and MRI imaging. There are a wide variety of different treatments, but the most common are surgery, chemotherapy, hormonal therapy, biological therapy, and radiation therapy. So some long-term side effects to these treatments include the following provided on this slide. Medical treatment is definitely necessary to remove, shrink, or slow the growth of tumors. People use many types of therapies and lifestyle changes alongside of the advised medical treatment to control symptoms. Just like most cancers in breast cancer, early detection is key. The earlier that it is detected, the more likely that it can be cured with treatment. 7 out of 11% of women with early breast cancer experience a recurrence, unfortunately. People with a family history of cancer or a BRCA1 or 2 gene mutations have a higher recurrence rate. In this last slide, I have mentioned the AI model I spoke about in my previous slide, which is able to detect if a person is likely to develop breast cancer as much as 5 years in advance just by examining a patient's mammogram. And in my last slide, I have listed the references which have helped me gather the information for this assignment. I'd like to say thank you for listening to my presentation. I hope you enjoyed.